All right. I'm very looking forward to this podcast on the menopause gut with my amazing friend, Cynthia Thurlow, because this is something, Cynthia, I've been diving into a lot about middle-aged men and women, but my word of the year actually is resiliency and how we can do things differently as we age, testing and not guessing and figure out, okay, how can I improve my future self and create that future you blueprint today and not wait until I'm struggling. So love your book. I always love everything you do. And I'm thankful for you coming on the show today.
Yeah, I've been so looking forward to this conversation. And I think that, discussing the way that our gut microbiome changes as we're aging is really critically important because I'd actually make the argument that the missing link for longevity for women is really understanding the microbiome and being able to support it in a way that fosters good
Mhm.
diversity and reduces inflammation. I think that, unfortunately, we have this kind of myopic view that it has to be just lifestyle or just hormones, and there's so much more to it than that.
Well, I was looking through your book. Granted, I was telling in the intro, I love a hard copy book. So I have to wait to get really dive into it deeper because PDF I find is so different than,
I know,
opening
I
a book. So I
know.
like a real book. But I love the story, your intro in the beginning of the book, because it really starts to show how did you even come up with this and start thinking about the connection of middle age and our immune system and the gut health. But what's funny, because I always seem to be similar to you, you were in a city I was just looking at, thinking we should live in for a few months. So
Yes.
talk about how you got to this point of being a near death state and coming to this menopause gut journey.
Yeah. So in 2018, my husband and I were celebrating our 15th wedding anniversary. And it was, just this wonderfully romantic trip that I had planned. We were going to start in Morocco, started in Marrakesh, which is one of these places that has such an exotic feel to it between the sights, the sounds, the smells, the architecture. Our trip started in Marrakesh, and that is very likely where I picked up a friend that didn't avail itself until we actually made our way to southern Spain. And so I jokingly say, like, I'm so grateful that I was not in Casablanca's airport getting violently sick. I was actually safely in Spain when I started getting ill. But what's ironic is my husband and I ate the same exact food our entire trip in Morocco. Same thing was in Spain, literally ate all the same things, but I'm the one that got so violently ill. And at the time I thought, oh, I'm just that person who seems to get foodborne illnesses more frequently than my colleagues do. And so I didn't think more of it other than the fact I didn't want it to ruin the rest of my trip. And wasn't until a few months later I was in Canada and got exposed to E. coli prior to my first TED Talk. And then fast forward to February of the following year, which is, of course, when I had that 13-day hospitalization. But the point of why I really started the book there was that even as a seasoned nurse practitioner, no one had ever really explained, nor had I learned the role of inflammaging and immunosenescence, which is a fancy way of saying the aging of our immune system, which buffers up against these alterations in estradiol and progesterone and testosterone. And the more that you understand about how our immune system ages, how our gut microbiome ages, it makes so much sense as to why my husband ate the same food, had no reaction, whereas mine had a full blown foodborne illness issue and really primed my body for this Giardia infection, which we believe probably contributed to the ruptured appendix. That's why I spent so much time in the hospital. And so when I sat back and really thought about it, which wasn't immediately because obviously there's just a lot of things that happen in a short amount of time, I was like, oh my gosh, I interview all these experts on the podcast. And suddenly I'm putting pieces together that allows me to realize that part of the information we need to be sharing with women in their 30s, not waiting till they're 40, 50, or 60, is that here are the things that are going to change in your body, which are a normal reflection of aging. And here are the other interventions, different strategies, additional ways we can support our bodies so we lessen the impact. And I'll be the first person to say, I'm like the canary in the coal mine. My husband jokingly says, if we had been born a million years ago, you would have been the person that would have died of foodborne illness a long time ago. But why is my body just much more sensitive to these things? And I think it really speaks to, and I'm sure we'll talk about this, the way that I grew up, the amount of stress that I grew under, how that influenced my autoimmune conditions, how that influenced my nervous system, which just makes me a little more like sensitive and yet attuned to the environment itself. So we add together introduction of bacteria, viruses, protozoa that my body wasn't had not been exposed to in the setting of being away on vacation, and then it sets this kind of path in motion, if you will, of the perfect storm to lead me to what happened in 2019. And for everyone that's listening, it doesn't have to be that dramatic, but for me, it was that dramatic. It made that much of an impression, but really allowed me to unwind like, what are the things that are changing in our bodies as we're aging, and what can we do about it?
Well, I think you're saying two things I've been talking a lot about is resiliency and the role of the vagus nerve as we age
Mhm.
and the accumulation of chronic stressors that start from when we're born till today and how we're able to handle that, combined with genetics, and then combined with the changes as a female in our microbiome. You've explored the role of the gut bacteria and how we lose resiliency. And with that, how does that impact our immune system? As you're saying, your immune system, talk about that and your gut connection.
Yeah, I mean, I would say the most research is really done around our predominant form of estrogen prior to menopause, and that's called estradiol. And so estradiol is this immune modulatory hormone that interfaces with our immune system. And I always say they're like peanut butter and jelly. I know that's a terrible analogy. There are a lot of people that are anti peanut butter and jelly for a variety of reasons, but they really do stick together. And as we are losing estrogen, it makes us more likely to be inflamed. We're more likely to develop leaky gut. We're more likely to develop food sensitivities. We're more likely to see alterations in diversity of the ecosystem of the microbiome. And perhaps I should back up and say that when we talk about the gut microbiome, we're talking about an area of the large intestine or colon that is 40 trillion bacteria, viruses, fungi, protozoa. There are more of them than there are of human cells, just to give you some scope of how massive this ecosystem is. And there are key points in a woman's life where the diversity of that microbiome changes. Number one is puberty, not surprisingly. Number two is pregnancy, if people choose to become pregnant. And number three is perimenopause. And so we take these three, the three big P's that we see throughout most women's lifetime, at least two of the three. If we live long enough, we'll see all three potentially. You see these key differentiations in diversity, immune modulation, inflammation, changes in short chain fatty acids. And all of these things lead us to, being more susceptible to autoimmune conditions, being more inflamed. We use that term inflammaging or inflammation so indiscriminately. I think it gets overused, but yet it is highly descriptive. Acute inflammation is good. If you're training and you injure yourself, acute inflammation will help you heal. It's the chronic inflammation that I'm really speaking to. And that's most of what we see here in the United States: chronic inflammatory conditions, poor metabolic health, et cetera. And so, kind of walking us through, estradiol is the biggest immune modulatory hormone that we have. I would make the recommendation or the assertion that progesterone is very important as well, but they kind of balance each other out, just like they do in our body throughout our menstrual cycle while we're in our peak fertile years and kind of the tail end of our fertility into menopause. And so helping women understand that these changes in hormones influence the immune system to be a little more reactive in menopause, late perimenopause. So, for example, we are more likely to develop autoimmune conditions. For anyone that's not familiarized with those, there's over 100 now. But there are things like lupus and rheumatoid arthritis and Hashimoto's and celiac. And like I mentioned, there's 100 of them. So there's many, many, many. But helping us understand, like, why are we more likely to get diagnosed with these things has a lot to do with what's changing in that immune system. More hyper responsive. And this is not a political statement, but if you look at the research, we're less responsive to vaccines. So every time I go to CVS to pick up my estrogen patch, the first thing they ask me, would you like to get a shingles vaccine, a pneumonia vaccine, or would you like a flu vaccine? And so
Yes.
for me personally, the answer is no, no, and no. But we also understand that we are less responsive to vaccines because we have an aged immune system. That's not to suggest, if anyone's listening, that if you chose to get one of those vaccines, that might be the right decision for you. but we're just less responsive. And that is a byproduct of this loss of estrogen. So, on a lot of different levels, this inflammaging piece, it will happen. It's how, what can we do to lessen the severity of it that impacts our health? I'll use another example. When I was still seeing patients in the hospital in the ICU, most of the ICU was filled with elderly women. And why is that? Most of these women were not on hormonal replacement therapy because they came out of the wake of the Women's Health Initiative, which we may or may not discuss. And that was a study that was shared in 2002 and really changed not only prescribing patterns, but whether or not women were going to continue taking hormone replacement therapy. And so we see a lot of older women in the ICU that struggle with things like urosepsis, which is a fancy way of saying they got a urinary tract infection, they got an infection that got into their bloodstream, and now they're very, very sick because the septicemia makes them very, very sick. And so that's something that's totally preventable. With that being said, again, it goes back to these things like there are commonalities of things that we can do in our middle age years that can decrease the likelihood that we ever need to be hospitalized later in life.
What is the role of estrogen on the microbiome that can impact our immune system and our health?
Yeah, it's a great question. So number one, we know it helps with diversity. So we want to have like, think about it when you go to the grocery store and you load your grocery cart up or you're at the food market with brightly pigmented fruits and vegetables. Well, I think about the microbiome the same way. We want diversity. We want different types of bacteria. There are keystone bacteria in the microbiome, but we want different types to help bolster the effectiveness of the microbiome. What starts to happen is as estrogen is declining, we get less diversity. We get more inflammatory species. We start seeing more things like dysbiosis, which is effectively weeds in this beautiful garden that we've planted. We have these fruits and vegetables that we want, and then what grows up in between are the weeds, and that's dysbiosis. But dysbiosis and leaky gut go kind of hand in hand. And so if you think about the small intestinal lining, it's one cell layer thick. And if you think about it as a brick and mortar system, so if you think about estrogen as part of the mortar system, which helps decrease the likelihood those cells will ever separate, where you can leak food particles into your bloodstream, when that happens, when you have leaky gut, it activates the immune system. It also leaks the food particles into the bloodstream. How many middle-aged women will tell me foods I've always been able to eat suddenly no longer work for me? And a lot of it has to do with we breach that intestinal lining with that loss of estrogen, probably plus or minus a couple rounds of antibiotics throughout our lifetime, a standard American hyper-processed diet, chronic stress, exposure to pesticides and herbicides. All those things can damage that one cell layer thick of the small intestine, which will provoke that immune response and leads to the sequelae of autoimmune conditions. I jokingly, but not jokingly, will tell people how many women listening are diagnosed with an underactive thyroid in middle age. Not at all uncommon, right? But that is almost always an autoimmune etiology, meaning it is almost always related to Hashimoto's thyroiditis. And just because you have negative antibodies, because a lot of people say, I've never had positive antibodies, I don't have Hashimoto's. I'm like, statistically, you probably do. It could be that, Debbie's super clean diet of eating gluten-free might be why she hasn't provoked those antibodies to raise. And so it kind of goes along that estrogen and the immune system kind of work side by side, but helping people understand that one of the things that drives that provoked immune system is that reduction in estrogen and then those lifestyle pieces. How many middle-aged women are still living like they did at 18 or 20, whether it's the way they eat, the lack of sleep, the chronic stress or the lack thereof of stress management, or they eat like they did when they were 18 years old. And you can't eat, hyper processed foods 24/7. I think the last statistic that I saw was that 70% of Americans, the bulk of their diet is ultra processed food. And that ensures that we eat more food, anywhere from 500 to additional 1,000 calories a day. We're exposed to a lot of emulsifiers and additives that can be damaging to that delicate one cell layer thick of the small intestine. Another thing that I think is really interesting about estrogen's role with keystone bacteria is that as we're seeing more inflammation, we're seeing a reduction in a very important molecule called short chain fatty acids. And I know it's not sexy, but I'm here to tell you we want to care about the fact that as we have a reduction in short chain fatty acids, which when we eat fiber, in our large intestine, it will ferment and we produce these short chain fatty acids. So we know that we get a decline in them, but they're important for a lot of things. Number one, for helping to secure the very delicate small intestinal lining. They help with reducing inflammation. One particular short chain fatty acid can actually cross the blood-brain barrier. So butyrate, really, really important. The other thing that's interesting is short chain fatty acids and key other keystone bacteria like Akkermansia, very important for endogenous GLP-1 regulation. And so these drugs that are out there, the GLP-1s, the tirzepatide, Ozempic, very powerful drugs. They're doing a lot of amazing things, but our body makes endogenous GLP-1. And so as those short chain fatty acid production goes down, we start making a little less. And it's one of many reasons why women will not be satiated. I have patients say to me, I'm standing in my pantry and it's 9 o'clock at night. I don't know why. There's a lot that is contributing to that. I would say it's multiple things. But one thing that's contributing is we have less circulating short chain fatty acids, which can exacerbate this reduction in short chain fatty acids, which can impact those satiety hormones as well. So there's many, many things that impact that. But that's just like a little piece of what estradiol does. Clearly a really, really important hormone. And the last thing that I would say to that, Debbie, is that when we look at microbiomes of younger women and postmenopausal women, if we give them hormone replacement therapy, the microbiomes start to look like younger women's microbiomes. And so I remind people that a lot of the focus on HRT is appropriately so, cardiovascular disease reduction, bone health, plus or minus, we're still evolving the research on dementia risks. But the research is heading in the direction that also hormone replacement therapy, in particular estradiol, can be beneficial in ensuring we maintain that younger looking microbiome. Not the wrinkle reduction that everyone likes to focus on, but really, really at a deep level allows our microbiome to resemble a younger woman's. And that's more diversity, less inflammation, less inflammatory species, and a lot of these other kind of topics that I've discussed already.
So having estradiol, we'll talk about hormone replacement therapy options, as I have my patch on. I did put my aloe estrogen cream, eye cream on, but it is more purpose. I was looking at why do we need that? Well, how does this work? Order of operations. Just summarize, you say, making up for that loss. So I would say embrace the aging process as we age, do things differently. So understanding what we get less of, as we talked about creatine in the past and collagen production. And now we're bringing to the table, let's talk about having estrogen back in your body that we're getting less of as we age with progesterone, but how much that impacts our microbiome to have more diversity and prevent a healthier gut. Because if we have leaky gut, bad guys get out and we have all sorts of different problems with chronic inflammation in the rest of the body. So working backwards, understanding what changes as we age and what we can do about it to take ownership today to improve how we age, that quality of life factor for your future self, I think is so important. And some simple things that we need to be aware of, as you said, as 40-something-year-olds, not wait till we're 50s to take action, to make taking ownership of your health, to be preventative. So we know this is going to happen if you don't do something about it.
Absolutely. And I think the biggest takeaway, I think, from the book, and connecting with so many people about podcasting and otherwise, is that I always say major in the majors. I think we as a culture love bright, shiny objects. And it's not to suggest there aren't fun ways that we can support our bodies as we're aging, but it still is very important, that sleep piece, stress management, nutrition, meal frequency, exercise, addressing underlying trauma. I mean, all those things are still there. So I would say major in the majors. Don't get focused on, and there's lots of fun gadgets. Let me be really clear. I get gifted a lot of fun things. I only share stuff that I like, but I got gifted a really cool gadget that can absolutely help with, stress reduction. But I'm like, that's important and that's fun, but you still have to find some way to manage stress in a proactive manner that doesn't involve a gadget, because ultimately, not everyone can afford those things, number one. Number two, not everyone needs a complicated system. Some people just truly need to do breath work. They
Yeah,
need to get
they just
out.
breathe.
Right, exactly. They need to get out in nature every day. They need to do some grounding work, probably not where I am right now, but definitely in Southern California, you can do that year round. But there's definitely things people can do that don't involve having to buy something. And so that's definitely the messaging I want to share because transparently, everyone's budgets are different. And I want to be super sensitive to that. The book talks about a variety of things. Like I always say, it goes from really basic stuff that costs nothing all the way up to some gadgets because some people like the gadgets. And I get that. But don't forget to major in the majors. Super
And
important.
they don't work though by themselves. I keep trying to tell clients that there's not a magic one supplement is going to fix your vagus nerve and improve your health and your everything downstream. That working as we learn nutritional therapy, north to south, a lot of it is choosing what you eat, how you digest and break that down. And that's a lot of being resilient, having that good nervous system, that vagus nerve, and then the lifestyle habits. It doesn't come in a magic device. You still, even in the devices, I do have different vagus nerve stimulators, but I still need to do the rest of the stuff. So yes, I agree 100%. There's lots of shiny, fancy, fun stuff to do, but nothing replaces the morning sunshine, the breath work, grounding, time in nature is just, you can't replace that.
Absolutely. And probably important to talk about the vagus nerve. So for anyone that's unfamiliar, it's the longest nerve in the body. It's a cranial nerve and it runs, from our brains to our gut. And so I remind people that we have encouraged our patients unknowingly to not trust their gut. We're like, oh, but we can't see it. We can't test it. I'm like, the nervousness that you get when you're around someone that you like, that's new, the icky feelings you get around certain people that, aren't in your best interest to be spending time with, the excitement that you feel when you're doing things that are really in alignment with what you love and what you were put on this earth to do. We need to trust those things. That information that is being conveyed from our gut to our brain and vice versa is so, so important. And it's interesting. I was telling this story on a podcast last week. I worked in cardiology for over 16 years. And prior to that, I worked in an ER trauma center. And I recall every once in a while, someone that had cardiovascular surgery. So when they go in and do bypass, which is a pretty serious surgery, sometimes they would accidentally cut the vagus nerve. And at the time, we really didn't fully appreciate how problematic that can be. But the vagus nerve really is this superhighway that is helping convey information back and forth between the gut and the brain. And I would actually argue that I think it is critically important that people know how to activate the vagus nerve. So if we kind of take a step back and talk about the autonomic nervous system, I'm sure your listeners are super savvy. Sympathetic, parasympathetic, they're designed to balance each other out. But in our harried, otherwise stressful lives, most of us tend to be in sympathetic nervous system mode. And those are the people who can't sit still. They don't relax very easily or readily. But when you're eating off your kid's plate and eating in your car and talking while you're eating and just never allowing your body to relax, that parasympathetic is what's intricately tied into the vagus nerve. And so we almost all of us need more rest and repose. That's what we should be doing. It's taking a couple deep breaths before we sit down to have a meal. It is people that are humming and singing and gargling. All those things can trigger the vagus nerve. Like when I am getting ready to step on stage, even though I enjoy educating people and speaking at medical conferences and speaking at events, even I get a little nervous, like in a good nervous way. And so what I do is I box breathe. What I'm doing is stimulating that vagus nerve. I am holding my breath, I am breathing, I am exhaling, I'm inhaling. It's really, really important to know how to activate the vagus nerve. I mean, there are things beyond that, like sticking your face in cold water, but that's not my first choice. I don't like the cold as a rule. But I think for each one of us, it's understanding how important it is to engage the vagus nerve and to do things that allow your body to be in rest and repose. That's how we digest food best. That's how our body detoxifies properly. That's how we're able to sleep well. How many middle-aged women have gotten to a point that they have accepted their sleep quality is terrible. And a lot of it has to do with the fact that they are sympathetic dominant, meaning that their body doesn't feel safe for a variety of different reasons. And that can contribute to why they are having trouble sleeping. So, vagus nerve, vagal maneuvers. I had plenty of patients that would pass out because they either pooped or peed or got nervous and they stimulated their vagus nerve and it dropped their blood pressure. And then they would pass out and they would end up in cardiology seeing us and having to have a conversation. So there's a lot of things that can stimulate the vagus nerve, but we want to find ones like I will sometimes walk around and hum, not so that I disturb other human beings, but if I know that I need to kind of like get myself out of, the lizard brain, it's like, okay, what do I need to do? We can hum, we can breathe. Those are things I can do that won't disturb most people. And I can do them in public ways without, having people turn around and be like, what is she doing? So vagus nerve, super important, not talked about enough.
Yeah, I've been talking about it every episode. I've really been going down deep rabbit holes, and it always comes back to the vagus nerve has a relationship in this situation, as today with gut health. And with that, what are your thoughts of connecting poor vagal tone as we have more stress, we're less resilient as we age? As females, we seem to be more sympathetic dominant than others, and correlating that information with estrogen, loss of estrogen, but also estrogen dominance, because I'm finding people taking estrogen, hormone replacement, and they're still, if I look at their labs and looking at the GI map and looking at information that they have or bile flow, and looking at why do we have this excess estrogen being recirculating in the gut and how we're having all these side effects. And we see different markers on the labs to give us clues to that. But I always come back to the vagus nerve and that connection, role bile, inner microbiome.
Yeah, I would say let's start from so estrogen is very important. It's interesting. Estrogen has an intricate role with bile. Bile is what helps us break down and emulsify fats. It's contained in the gallbladder. But what starts to happen is estrogen declines, you start becoming more fat malabsorbed, meaning your body's going to struggle more with emulsifying, breaking down fats. But there's also this enteric hepatic circulation. So when a woman is considering hormone replacement therapy, going on hormone replacement therapy, we have to think about detoxification pathways. And so the enteric hepatic circulation is critically important for the estrobolome. The estrobolome is where our body breaks down and packages up estrogen and hopefully poops it out. I'm going to oversimplify things because I had someone tell me the other day, don't say the word defecate or bowel movement. It's too clinical. So we're going to be very non-clinical and just call it poop. But we can be low endogenously inside our bodies with estrogen, but we may be exposed to a lot of estrogen mimicking chemicals in our environment, our personal care products, our food. That's why the lifestyle piece is still super important. And the other thing is these endocrine mimicking chemicals can offset the receptors where estrogen docks or any other hormone, and they can magnify, they can be far stronger than the effects of estradiol can be. So it can explain why a woman could be in menopause, be low in estrogen, and still have estrogen dominant type symptoms. So that's number one. Number two is we know the bulk of detoxification of hormones is taken care of in the liver. And so a lot of people use the word detox very loosely, but our body is designed to properly urinate, defecate, sweat, and our liver is the primary site of detoxification in our body. So it's where most hormones and chemicals and other things go to be broken down into water soluble metabolites and then go to the enteric hepatic circulation into the estrobolome where they're supposed to be packaged up ideally and then gotten rid of. But what happens when you can't properly break down your estrogen? It can be recirculated. And as you astutely stated, that can explain brain fog, breast tenderness, heavy menstrual cycles if you're still getting them, joint pain, a whole constellation of symptoms that women can experience, which are incredibly unpleasant. And so the estrobolome is very important. It ages right along with us. And that's why the lifestyle piece, having citrus fruits and bitter greens and cruciferous vegetables are all very important. And if you think it's normal not to poop every day, I'm here to tell you it's not. And if you understand how that, the estrogen present is supposed to get out of the body, you have to poop out the extra estrogen, ideally. So I think there's multiple things here. Number one, before we even talk about hormone replacement therapy, we have to make sure that those detoxification pathways are open. It means we're
Yeah.
hydrated. It means we're sleeping. It means we're pooping every day. Because how many women listening have gone on HRT and gained 10 or 15 pounds seemingly overnight? It is not your fault. It's that we didn't do some other foundational elemental pieces prior to starting hormones. Because if
Thank
you
you.
think about it, if your body isn't effectively able to package up and get rid of excess hormones or even break them down properly, some of that's genetics. Like I'm homozygous for MTHFR. That is not going to change. I'm not going to suddenly have a new genetic imprint. My imprint is has been designed for a long time. But there's extra things I personally have to do to support my body. Not every person, although they say it's anywhere from 60 to 70% of us have at least one copy. So we're at least heterozygous for MTHFR, and that's a genetic SNP. And I don't even want to go down that rabbit hole of talking about the genetics piece, but it also influences how we package up and process hormones. So number one, very important to make sure those detoxification pathways are working properly. And it's as simple as hydration and eating nutrient dense foods and making sure you're having a bowel movement once or twice a day. And if you're not, you got to work on those things first. And then also, it's understanding that the estrobolome ages right along with us. It's part of the microbiome, but very, very important that we're doing specific things to help support it. And I think for a lot of individuals, it's incredibly validating to hear like these are things we can all be doing. And when you mention the lab piece, what are some of the clues that I see on diagnostic testing suggestive of someone that probably is struggling with detoxification? Number one, you'll see an elevation in a very important enzyme called beta glucuronidase. And this is the hormone that goes in and kind of, or excuse me, the enzyme that kind of goes in and clips the estrogen so that we can break it down and get rid of it. When it's elevated, sometimes you need more support in the body. There's other types of testing that looks at how do we break down estrogen in our bodies. Some people, it could be the type of hormone replacement therapy that you're on that is pushing estrogen down non-beneficial pathways in the body. And I'm speaking to the Dutch. It's probably one of the most important reasons if I choose to do that study, which I don't do as much anymore, is to see, are you breaking it down beneficial pathways, the ones that are less likely to be problematic. And I think for a lot of individuals, it's just getting clarity around what are the things I need to do? Is there a lot of inflammation in the gut? What does my diagnostic stool testing show? Do I have H. pylori and possibly candida? Are there signs that I have SIBO, which is small intestinal bacterial overgrowth? This is when organisms that belong in the colon start creeping into the small intestine, which will produce a massive amount of bloating. You can also get SIFO, which is small intestinal fungal overgrowth, although not as common. And traditional allopathic medicine is maybe just starting to kind of catch on to some of these things, but there's a whole constellation of things we can see on stool studies. Even, what's your keystone bacteria look like? We know those change with age as well, but what are the things we can do to support the microbiome? And it always starts with lifestyle, and then we kind of bleed into supplements plus or minus medication depending on what we see. But first and foremost, estrogen metabolism is very, very important for women.
Mhm. I appreciate all that because I keep seeing that in labs of middle-aged women. I start to see these patterns. And so I've been doing all these rabbit hole podcasts explaining deep dive, all right, work backwards and have order of operations. And I feel that so many women are given the peptides and hormones without proper preparation of their terrain and creating what I'm finding, I keep saying, is a flow foundation, create order of operations before we give you this. Yes, we need some estrogen, progesterone. I totally believe in it. It works for me. But is my body ready for it yet? So I did my own little protocol before I started taking progesterone and adding my patch on. And I think it's important that so many people think, am I ready? Because I don't feel that all these even naturopath functional medicine doctors are actually doing that before they readily prescribe GLP-1, same thing, any different peptides, and then the hormone.
Yeah, and it's interesting because I think there's definitely a place, like there are women out there that are really struggling, and it's, beginning of perimenopause, mid perimenopause, really struggling with sleep the week or two prior to their cycle. It is totally fine to give them some progesterone. That is not what I'm saying. But I think when we start looking at the constellation of hormonal replacement therapy, it's with the understanding that we have to look at our patients as bio individuals. We have to tailor everything we're doing. I think that we are in a stage, I mean, you and I grew up at the same time where thin was in, we weren't focused on being strong. At least that's not what we were telling patients. And now we're realizing like that was really terrible advice because what we have is we have a overall like a very metabolically unhealthy population. And I think GLP-1s are helping with that. I want to be really clear. I think they're incredible drugs. And we know if we look at the research, women that take HRT and GLP-1s actually have better body composition. They're doing really well. But it really speaks to the fact it's never just one intervention, it's multiple things. It is never just one thing that's going to fix a broken metabolism or fix metabolic health. I think it is, probably 10 things all in different levers and strategies that can be very, very effective. And so I know your community is very grateful that you are so methodically kind of diving into these topics because, quite transparently, I mean, even as an allopathic trained and integrative trained provider, I sometimes look at what my peers are doing. I'm like, put the brakes on, like pump the brakes. You need to go back to the basics because if you don't master the basics, again, you have to major in the majors. And I jokingly say, what goes on in the gut doesn't stay in the gut. It's not like Las Vegas. Like we really do need to understand that the health of our gut impacts every single organ system in the body. It impacts when we go into menopause. It impacts the health of our bones. It impacts brain health. And yet we seem to still think of every body system is in a silo. That's a traditional allopathic kind of
Mhm.
model, but yet we're learning that's actually not the case. There's constant communication and crosstalk between all these different organs and body systems.
Well, two things I want to get to too is connecting the weight loss resistance is it's harder to build muscle. It's funny, I beginning of your book, you're mentioning 2020 when you met Dr. Gabrielle Lyon. We're all at the
Hmm.
nutritional therapy conference right before the pandemic started,
Yeah.
ironically, and how I met you and
Hmm.
Gabrielle and Dr. Anna Kabaka, you're on this
Yeah.
panel, and it's so amazing to see all you guys transform in your field, creating this impact, but putting it all together on how we need to take responsibility today to do things differently as we age with the struggle to gain muscle. I'm trying to do all the right things, but I'm not getting results, is what a lot of middle-aged women say. And how we have to do things differently, we were talking about. But going back to the GLP-1 and the insulin and the estrobolome, how that's connected, why we have to change to, if I want to lose weight and I want to gain muscle, what that impacts our choices or how we
Yeah,
do
no.
things.
I mean, I think that in 2020, when we met, I was still very much on the intermittent fasting bandwagon. And I'm the first person to say transparently, it is okay to change your opinion. For anyone listening, that does not mean that I don't believe intermittent fasting is a great strategy. But if you're trying to build muscle, that may buffer up against your ability to actually build muscle. So for the last 18 months, I've been doing a lot less fasting, although transparently, when I travel, I do fast just because more often than not, there's crappy food in the airports and I just don't want to eat it. But I think for a lot of individuals, it's looking at what is the greatest, like, what are your top things that you're focused on? If it's building muscle, you can't eat in a compressed feeding window 24/7. You just can't. You're going to struggle to put on muscle because you're not eating enough protein. And, when I think about the really granular things that impact weight loss resistance, number one is sleep. There are still women out there who think they can get by on 4 or 5 hours a night of sleep. And I'm here to tell you that is not the way to change your body composition. It is unresolved trauma, whether it's from your childhood, your young adulthood, a toxic marriage, a toxic job, whatever it is. If you're not dealing with your stuff, perimenopause has a way, and I just did a Substack on this. Perimenopause has a way of ripping the band-aid off. Like you have to deal with your stuff. I see a lot of women that don't sleep well because they have unresolved trauma and issues. Their body doesn't feel safe. If your body doesn't feel safe, you're
Yeah.
going to struggle with your gut health. You're going to struggle with mood disorders. You're going to struggle with body composition issues. Number three, we eat too much and we eat too often. I'm going to be totally clear about that. We eat too many of the wrong things and not enough of the right things. So, really protein centric, eating fiber. Yes, eating fiber. I jokingly say that fiber is the new F word because depending on who I'm talking to, I sometimes am censored. Don't talk about fiber. It isn't necessary. Well, if you
Mm.
understood what is going on in the microbiome as women are navigating perimenopause and menopause, you will understand why very much the N of one. Like Debbie, you may be able to tolerate 30 grams of fiber and someone else tolerates 50, and maybe I tolerate 25. Very bio-individual, but the research is clear how important fiber is for short chain fatty acid production, which we know declines in the setting of less hormones. I think a lot about alcohol. How many women think it's benign? And we have this mommy drinking culture, which is really, during the pandemic, my husband and I used to walk through our neighborhood in Northern Virginia. And what did we see in the recycling bins? Not a little bit of alcohol, a lot of alcohol, a lot of spirits and wine and beer, and no judgment because we were all trying to survive, right? But there is a strong mommy drinking culture. And I'm here to tell you that if you need to have half a bottle or a bottle of wine every night to relax, you've probably got some things that you need to deal with. And I say that lovingly, like find a therapist, find a psychiatrist, psychologist, someone you can talk to so you can unload some of those things that you're internalizing that you feel like you need to consume. And it's not to suggest like it's a birthday, it's a celebration, enjoy the glass of champagne and be done with it. But your relationship with alcohol needs to change in middle age. Not only is it problematic for leaky gut, cortisol, poor estrogen metabolism and detoxification in the body. We know it increases your risk of rate of multiple different types of cancers. And that's habitual use, not like the once a week or, once every couple months. I also think about being sedentary. Not only is it not good for your microbiome, but we know physical inactivity is problematic in and of itself. And so wherever your starting place is, if you're a couch potato and you're just starting a walking program and body weight exercise is great. Whatever that is, getting a baseline assessment. I'm a huge fan of data. And so just like with your sleep, if you are a data nerd like I am, I like to wear my Oura ring. Although right now it's charging. I like to check a VO2 max. We used to say you do it once every 10 years, and Dr. Andy Galpin told me it's once a year. And then someone else in the audience at Eudaimonia said, no, it's once every 3 months. And I was like, oh, pump the brakes. I'm not sure I want to do that every 3 months. But the point being, get an assessment of your functional fitness. Then we look at gut health. So that's why I think stool testing is a must every year, really getting a sense of what's going on. Are there opportunistic infections? Are there things that we need to address that are problematic? Then we go back to that trauma piece, and that maybe that's not the case for everyone, but I encourage anyone, you can go online. There's a adverse childhood events. You can look at it. It was a joint venture between Kaiser Permanente and the CDC. It's a, 10 or 15 questions you can quickly answer. If you've got a high ACE score, you got work to do. And I say that transparently and personally, that is something that I will probably be working on forever. So you kind of see this like domino effect of things that can impact weight loss resistance, not the least of which is that underlying trauma, chronic stress. I think about how many women, maybe they ended up in a marriage they weren't happy in, maybe they're unhappy with their job, maybe they had overt abuse as a child. All those things start to kind of simmer at the surface. And I think the statistic that I saw last was that 70% of divorces are initiated by women. So the question is, what starts to bubble to the surface in middle age? I think that's when people lose their filter. Estradiol is an important bonding hormone, but as your estradiol levels are going down, you may have been a people pleaser your entire life. That would be me. And I just started to find my voice in my 40s and realized, like, hey, I don't want to do that anymore. And I don't want to have to explain myself. And this is just the way things are. So I think for everyone listening, it's figuring out like what are the unique things that you need to be changing. Is it an elimination diet? Do you need to put yourself to bed an hour earlier? Do you need to start saying no to things you don't want to do, like having better boundaries? Or instead of going out and having, a night of drinking with your girlfriends, you're like, I'm going to go to bed early so that I can get up and go to the gym in the morning. And it's those types of choices that can have a lot of impact on weight loss resistance.
Mm-hmm. I was just working on a podcast yesterday on that weight loss resistance piece because I had a few 30-year-olds that are young mothers with 2, 3 kids
Mhm.
working full time. They wonder why they can't lose weight. And
Yeah.
I'm doing my Pinoy metabolism testing on them, did the resting RMR and trying to get them to do the exercise test because it's just, how many calories you burn a day is not really what we need to look at. It's looking at, yes, are you burning fat or carbohydrates? But I need to see, how are you breathing? How's your
Hmm.
stress system? How's your vagus nerve, heart rate variability? And how's your sleep? As you're saying that, it's not just what they all say. I'm eating clean. I always say air quotes, like, what does that mean? Because it can be
Well,
good
that's
food, but it might not be healthy for you, might be inflammatory,
well, and that's where I
right?
think, having a food diary where they write down everything they eat, and then you can objectively look at it. And I would say, don't tell me what you think I want you to be eating. Actually tell me, are you having a piece of pie? Are you having two glasses of wine? Like, I need to see all of it. And to your point, we can be eating clean and we can make the argument that grains are benign and gluten is benign and dairy is benign and alcohol is benign and sugar is benign. I'm in the midst of teaching a 5 week sugar. When I say the word detox, it's whole
Reset.
nutrient full. Yes. And I love that program because it's really impactful. I mean, we're 3 weeks in, 2 weeks into the detox. People are losing weight. I have one woman saying my pants finally fit right. And it's like all they're removing is sugar. And so when I think people say, I'm eating clean, I always say, what, tell me what that means to you,
Yes,
because it might
exactly.
be different. Like your definition might be different than my neighbor's. And I think for a lot of women, we are sugar addicts, and yet we don't want to talk about that inconvenient truth. We don't want to admit, oh, when my kids go to bed, I eat a chocolate bar or I eat an ice cream. And there's nothing, it is totally okay to have an occasional indulgence. But I know when my kids were little and I was in a super stressful job and my husband traveled a lot and I was single parenting, what was I addicted to? Sugar, because that was what got me through my workday. That's what got me through the evening when my kids would be in bed and I'm like, oh, now I get to have that chocolate. And I would just be so happy. But the realization was that in my best interest? No. It made me, feel fluffy and inflamed and all those things. So bravo to you for helping your patients and your clients figure that out. And to your point about HRV, I always say HRV does not lie. So when I'm looking at my aura, if I'm doing a lot of talking, so right now I'm in the midst of this book press. So like some days I have 3 podcasts a day. Like this week I had an audiobook yesterday, I have 3 today and 3 for the next 4 days. And I was like, my HRV is going to be in the toilet because I cannot stay hydrated enough. In order to stay hydrated enough, I'd be running back and forth to the bathroom. And so I was telling my husband, like, my HRV this morning was 27. I didn't feel bad, but normally I'm in the 50s if I'm sleeping well and managing my stress. And so I was like, this is a temporary blip, but my body is definitely feeling the responsibility of, showing up as an introvert and doing these interviews, which is great. I love doing this. But I think for each one of us, it's getting really granular. What are the things that impact our heart rate variability if you monitor those things? Like mine is altitude. If I'm in Denver, my HRV tanks,
Mhm.
travel. And then if I'm dehydrated, those will definitely impact my HRV for sure.
Well, you can't go outside, you said, and walk and do any grounding or see morning sunshine and be in
Well, I can
nature.
walk with my
Breathe.
dogs. I can do that. But today was so much warmer than the last week and a half has been. I said to my husband, I can't believe I'm going to say this, but I have a hat on and gloves and a winter coat, and today feels balmy. Like this is exciting. It's not 9 degrees like it was the day before,
Oh,
because you can
geez,
actually
that's
walk
good.
when your nose and your fingertips and your ears aren't frozen. But yeah, it's the challenges of winter weather for sure.
Yeah, that's when you come visit Debbie.
Yeah, exactly. All the people in Southern California, you've got it right.
I know, we pay for it. But going back to just a side note on the fiber, because we want to have diversity in the microbiome. Fiber is always a huge topic, whole nother episode to do. But that we're feeding the good microbes and
Hmm.
they make us short chain fatty acids
Hmm.
basically. And butyrate is a key one that's involved in the microbiome, the barrier. And that fiber, I think, gets misunderstood for people that they think they need all these vegetables, but you can get fiber from non-vegetables. So the people that are, plant anti-plant food, that there's other ways to get fiber. So could you tell us
Hmm.
some other options if people are the anti-nutrient plant fear-based people?
Yeah, and I will say one thing. When a woman tells me she doesn't tolerate fiber, the first thing I say is you've got
Mm-hmm.
a lot of work to do on your microbiome because, and I'll make this relevant. In 2019, I spent 13 days in the hospital. I was on 6 weeks of antibiotics and antifungals. I didn't tolerate fiber for about 2 years. And when I say 2 years, Every time I tried to reintroduce a vegetable or anything, I was oxalate sensitive. I would get diarrhea. I'll just be completely frank. So when a woman tells me she does not tolerate fiber, I'm like, we have
Absolutely.
work to do because you should be able to tolerate some. That bioindividuality piece is very significant. Maybe this woman tolerates 10 and someone else tolerates 50. But when I think about kind of unique ways that we can integrate fiber into our diet, I think about artichokes. I think about hearts of palm. I think about flax and chia seeds. I think about things like that. Even hemp seeds can provide some degree of fiber. And I think it's also very important. I think people, when they think about fiber, they're like, I just need a big salad. I'm like, there's actually not a ton of fiber in that, but it is really having diversity between, low glycemic fruits, vegetables, and other such things can be very, very helpful. I mean, there are products like inulin, there are things like PHGG, but I tend to not introduce those until someone can tolerate food-based sources first because they can be incredibly bloating in even teeny tiny amounts. Like I had one patient that was using partially hydrogenated guar gum. That's what PHGG is. And she could tolerate, I'm not kidding, a 16th of a teaspoon without it causing bloating. So, from my perspective, there's lots of fiber supplements that we can introduce, but I usually like to try food-based first. But I
Yeah.
do find flax and chia seeds tend to be great because people can throw it into a smoothie. They don't even think about it being fiber. In fact, a lot of my female patients that are on GLP-1s, the way that we get them to poop every day is we introduce a tablespoon of flax, fresh ground flax, and fresh ground chia. And for whatever reason, that along
Does
with
the job.
like it gets things moving. And so that's how we get them to not be constipated, even at low doses of GLP-1s. But those are usually the things that I have found. It's like the sneaky. When I say sneaky, not sneaky in a negative way, sneaky as in it doesn't register in my brain that I'm consuming fiber. I think those things we seem to do really well with those because people don't perceive it's like, I don't want to eat another vegetable. Like that's usually what I hear. I don't want to eat another vegetable. I'm like, okay, then we'll work around that.
Yeah. Well, I know we're going to run out of time, but just for our listeners that are typically fit and healthy on the outside,
Mhm.
not so healthy on the inside, I say, and helping these high performers who think they're doing all the right things to improve the aging process. There's a lot of information in this book that I think is really important for people to read, men and women, so
Mhm.
we understand what we can do differently and how things happen. Because I'm finding more and more clients coming to me, at least my client are the ones that are doing everything too much,
Yep.
right? Like
Yep.
less is more mantra comes in,
Mhm.
that they're the type A driven, ambitious, high performer that I need to like, let's bring it down a notch. So how can this help those high performing women that are trying to be superheroes and invincible?
I think you have to have a mindset switch. I think more than anything, instead of adding, we need to remove or reduce. And that is a mindset screw for a very type A, goal oriented female. If you want to thrive in perimenopause and beyond, you have to learn to subtract and not add. And I mean that with great love and reverence because I was one of those people that was up at 4:30 in the morning at the gym doing tough conditioning classes, going to the hospital immediately afterwards, sleeping 5 or 6 hours a night. I'm telling you, that is why perimenopause was so rough for me. And when I changed a lot of those things and I started doing less, not more, I was sleeping better. My body, was like, oh, I can take it down a notch. I was still lifting weights. I was still doing the right things, but I was, more recovery days, not as restrictive about carbohydrate intake, not as restrictive about fasting. And I think for a lot of women, especially, the women that follow you, that is a lot to wrap your head around. So you need to find a reframe. The women that I see struggling the most in perimenopause, without question, are the women that are unwilling to change their lifestyle. We're not suggesting that you go out and be a couch potato and eat chocolates every night with reckless abandon, but I am suggesting that you subtract before you add.
Yeah, so true. I mean, I was just recording this yesterday that we're on the other side of the bell curve, not the sedentary couch potatoes, but the ones that are
Mhm.
doing my old self doing too much
Yeah.
of everything, and how to bring it back into that Goldilocks effect to create the positive outcome that we want to improve the aging process.
Yeah.
So it's quality of life, and get through this. As I say, I'm same age as you, and I'm still not officially menopause, and I don't even know if I'm going through it or not. I'm not having all these, the hot flashes and this and that, knock on wood. But I think it's because we're taking ownership of our health, trying to
Yes.
navigate through middle age, really prioritizing. Like, I moved and changed my whole life, my career, to take care of myself. And so I think it's really taking self-care, making it a priority, putting that oxygen mask on first, doing everything you can do to be your best self.
Yeah, absolutely. And I think that is challenging for women to do when they have been, everything's been an extreme for such a long period of time. It is hard to wrap your head around. It is hard to change, but yet the one thing I can tell you with 100% certainty, the person I am at 54 is very different than the person I was at 44. And I am 100% committed, just like many of my patients, just like you are, that finding the reframe for that change is that it's not coming from a place of lack. You're looking like this is actually going to allow me to perform better. I'm going to be more energetic. I'm going to sleep better. I'm going to engage with only the people that I want to spend time with. I'm going to manage my stress better. It really is an evolution of self. And I think the sooner that we frame it that way, the more accepting we are of the possibility that there's so much more to our lives than where we were 10 years ago, 5 years ago.
I love that. Yes. That's why I'm really focusing on helping people create their future you blueprint, because you and I have talked over the years of losing our parents and having illness, and watching your parents age is, to me, in middle age, that's shifting my focus to what I should do now differently, because I'm watching what's happening in their 80s and all their friends going, whoa, we don't need to have that happen. It's choices we make today that's going to show
Absolutely.
up later in life. So I appreciate what I've learned from you and having you as a resource, and this new book coming out. I can't wait to get the hard copy so I can
Yes.
put
And
all
it, well,
those
and
tabs on the pages.
yeah, no, it's interesting. The Menopause Gut is definitely a book you are going to want a physical copy of because there's so much information. And I say this as someone who just did the audio recordings over the past week, but it also, from the perspective of it's something that you're going to go back and read again and again and again because there's so many nuggets. No one is talking about this, and yet we're really talking about the gut as a longevity organ. It's the spoke in the wheel, whether people want to acknowledge it or not. The better care you can take care of your gut microbiome, the better your health will be long term. And I was not kidding when I said the health of your gut microbiome impacts your bones. Like people are not making those connections, but yet the research is solid. And so, I feel like again and again, these conversations are so important for women. The earlier we can kind of lean into this information, the easier it's going to be long term.
Yeah. And that's why another time is talking about testing and not guessing. You mentioned a few tests, and there's lots of resources in the book. I know I just did my GI map for my birthday and tied it together with my blood chemistry and my mitochondria me screen test I did. And it's just so important that I had to change things up a little bit. And I realized I was not having good bile flow, and really impact your cell membrane and your brain health and just the whole thing. So I think it's so important for us to test, not guess, and get a personalized program to figure out what should I be doing instead of being stuck in that cycle of trial and error. So I appreciate all the resources plus the recipes in there. So we'll make sure everyone gets a book and shares what they're learning. And where should we send people to learn more
Yeah, the
about
Menopause
the
Gut will
program?
be published on April 28th. You can get it anywhere books are sold, Amazon, Books a Million, Barnes and Noble, Target. Although if you have a brick and mortar store in your area, please, please, please give them your business. I know nowadays we're like, it's so easy just to get online and hit Amazon and have it arrive the next day. This really is the thing I'm most proud of professionally that I've ever done. This book was literally blood, sweat, and tears, but in the best possible way, because I think it'll be incredibly impactful. But you can find me online. My website is www.cynthiathurlow.com. I'm active everywhere: Instagram, Facebook, X, although occasionally I can be snarky, although less snarky lately. I am on Substack. That is probably my new favorite passion. And then active on YouTube. But I'd love for you to reach out. And of course, Everyday Wellness is my podcast, and we still need to get you on the podcast, Debbie. post book. It is another thing I'm really, really proud of. It's one of my favorite things I do in my business for sure.
And you just had Dr. Andy Gaplin. I saw the email came out
Yes, that
today,
was
so I
a
have to listen to that
pneumonia.
on my car ride.
Yeah,
So love that.
he was an
Good.
incredible, incredible interview. Really an honor
Love
to connect
listening
with
to him.
him.
Good. Well, thanks so much for your time today, and I'm excited for your journey. Hopefully, you can take some time out and go to a